All right, so you guys heard a little bit about this. I just want to make sure I know what I'm doing here. So what I want to be doing is talking to you a little bit about the COASY trial. The formal name was a phase 2 study of a vitamin metabolite in PKAN. We had private conversations with our PKAN families yesterday, so you have heard some of this and more, but I will just be covering it briefly today in a slightly more formal way. So, we had 3 questions to ask with this study. So this was a study of basically a metabolite, something that bypasses the block in PKAN, so something that's downstream of the block in PKAN, the traffic jam in PKAN. We had 4 questions actually. We wanted to know, is this compound that we called COASY, it also goes by the name 4-phosphopantothene, is it safe? Is it well tolerated, meaning does it cause side effects or health problems in people with PKAN? And then as a secondary question, we really wanted to know, does it change a blood measure in PKAN that is sort of relevant to the disease and relevant to the way in which this compound is working? So a blood measure that is also called a biomarker. And then as a sort of a second question, we were urging all of you who were involved in this trial to keep up with PKAN Ready, because we're doing this other analysis that is sort of separate from the trial, that is looking at natural history data collected in PKAN Ready that you heard about from Allison prior to the intervention and after the intervention. So the way the trial was designed, we had people 6 months. For the first 6 months of the study, they were randomized, meaning they were put into one of 4 groups, taking a placebo or one of 3 different doses of COASY, which I'm calling low dose, medium dose, and high dose. And that first 6 months, after the 6 months, that 6 months is called the double-blind phase. And we talked about this yesterday, but what we mean by that is neither you as people participating in the trial, nor us as the investigators in the trial knew who was taking what. So I had no control over it, you had no control over it, and I had no visibility into it, nor did anybody in our team. It's really important to do a study this way because it keeps one from being biased or having what's called a placebo effect, where if you believe yourself to be on something, then you can show benefit even if it is not actually doing anything. We want to know that if we're seeing changes, they're not simply due to chance. And rigorous studies are typically done this way. So we called that first 6 months the double-blind phase. This is the most important phase of the clinical trial, and it is the phase in which we have been looking at the data most intensely. The second part of the study, after this first 6 months, everybody went on to a further 18 months on just the medium dose of the drug, and this part of the study is called the open label phase. We planned for about 50 participants. So this was 12 people. We wanted to get 12 people on average in each group, with an equal mix of people who were classic and atypical in each group. And then we allowed a few extras to allow people, some people to drop out if they needed to for one reason or another. In fact, we did not have dropouts in the first 6 months. We hoped to get 50-ish participants. We gave ourselves up to a year to be able to enroll that in an ultra-rare disease. However, we enrolled everybody in 3 months, which it was kind of extraordinary. This never happens in any clinical trial, almost, and it almost never happens. I don't know that it ever has happened in an ultra-rare disease trial like this, but we enrolled our entire cohort in a little over 3 months. And so with that, and we still had people who wanted to come in, so we actually expanded our goals to continue enrollment, and we enrolled over 70 participants, and we planned to extend the duration of the open label phase for 30 months. So we started the trial in December of 2019, and we all have trouble remembering what December of 2019 was like, because our lives changed very dramatically soon thereafter. In December of 2019, nobody had really heard of coronavirus. Then we had a pandemic, and almost every clinical trial in the United States and around the world was impacted by this, because most clinical trials involved people coming to a study site and being seen in person. Because this was deemed to be a low-risk intervention, we planned this trial to be a remote clinical trial where people would participate in their own communities. And we had the buy-in of both the National Institutes of Health, who were funding this study, and also the Food and Drug Administration, who were overseeing the trial in some ways. And so our trial, in contrast to most clinical trials, continued really without interruption despite a global pandemic, which was really sort of remarkable. We had an amazing team, and I hope, Sarah, I have your permission to show at least one of the participants here, 2 of our participants. I think I got this permission before. So we had just an amazing team doing this. It was an extraordinary effort to make all of this happen. Sorry, let me go back here. You see Katrina, who I think many of you may not have ever met in person, but talked to. Allison, you just met right now. Everybody else here, I think you know, except perhaps these 2 here are at the Oregon State team, who were helping us make the strawberry syrup that we used for this. And all of this was done remotely. So the compound was mailed to people, cold packs, and, oh gosh, this keeps jumping ahead. We had our team at OHSU. It was just this mammoth shipping exercise every time. It was quite a scene. But it worked really remarkably well, and we were all working at home, trying to keep the study rolling, and it went remarkably well. What actually wound up sort of challenging us was not the pandemic. It was actually a Texas deep freeze event that happened in February of 2021. I don't know if you remember this, but this particular state that we're in right now was completely paralyzed by an amazing winter storm that basically shut the state down. And what this led to, that challenged our trial, was the shortage of a compound that we needed for synthesis. It was not a chemical that was needed for synthesis, but it was actually a resin that is used in the final purification process. It was sort of tied to a chemical company here that made this resin, and it was critical to the final synthesis step, and it was very delayed. So what we had to do is to go back to our original design, and instead of planning for 30 months for the open label phase, we actually went back to the 2-year plan that was originally designed. But that was really the only impact. So our results at a very high level, and I'm not going to talk about them in detail here in this group. We asked the question, is COASY safe? And again, we've only looked at the open label phase data so far. All indications are that it absolutely is safe. which is what we would expect. This is a vitamin metabolite that is synthesized to very high drug standards, and we did not see any safety problems with it. Is it well tolerated? Can people take it without health problems? Can they take it without significant side effects? Yep, they absolutely can. And then perhaps most exciting to us, and actually very important for the FDA. The FDA was particularly interested to say, does it change a blood measure in PKAN? And in fact, it does, in a way that we predicted. We proposed that it would change in a particular pattern, in a particular time frame, and almost everything that we predicted happened as we predicted, in a way that was a little stunning to us, actually, how true it turned out to be. We'll be giving you more details about that in time, but we are tremendously encouraged by these results, and we need to look at them some more. The time it took to get to this point, I know, has been longer than any of us wanted, and I think we have heard at this meeting that we have not been as effective as we could have been in communicating what we were up to in this time. So apologies for that. But to do the biomarker analysis took extraordinary care, and we actually have only become unblinded, able to look at the data in a really quite recent time frame. So our statistician, if you've ever been around statisticians, they're hard to get excited about things. And our statistician, when she finally was meeting with us to show us the unblinded data, she started out by saying, I am so excited to show you these data, which we were kind of jaw-dropped about. So we're pretty excited about this. We're hoping the FDA will be. I just want to talk a little bit about next steps. So we are planning to have more communications with you as a community in the very near future to give you some more context for these results. And we are planning to meet with the Food and Drug Administration. We've actually already initiated plans for those meetings. And we may be doing some small follow-on studies to answer some additional questions. We'll be sending out a survey in the near future to find out from the community whether there's interest in doing these much shorter targeted studies, which we hope to use our existing infrastructure for, so that you can do all of that in your own community if you are willing to help us in those additional follow-on studies, which I think will be much shorter and simpler than the major clinical trial. So I just want to acknowledge the team that was involved specifically in the clinical trial. There's the OHSU team, most of whom you know and have met. This is our Data Safety and Monitoring Board, who are independent and have been looking at the data with us. We'll be meeting with them shortly. This is the team from Oregon State University who helped us develop that strawberry syrup that you either loved or hated. And this is the team at Washington State University who will be doing a more detailed analysis of the natural history data for us in due course. And finally, I just want to acknowledge a really key and important part of this that is sometimes overlooked is our funding sources. So before we started the clinical trial, we had small grants, and even during the clinical trial from this organization to help support one particular aspect of the trial. We had small grants to get us to the point of being able to even think about doing a clinical trial. And then we had major funding from you, the family community, who did an astonishing job in fundraising to help us be able to synthesize the compound to get to the point of the clinical trial. And finally, we were successful in getting a very substantial grant from the National Institutes of Health to actually conduct the clinical trial with additional support from Spoonbill. So with that, I'm actually going to, oh, I thought I had a final slide showing my team. But I was going to show the rare disease picture, an earlier one from a previous year, because it showed Katrina and a couple of the people who have now moved on. Katrina, who many of you have spoken to on the phone throughout this trial, is now in medical school and on her way to become a doctor. I'm hoping we'll seduce her back into the field too. So with that, thanks very much. I don't know how we're doing on time, whether I have time to take a couple of questions or we'll do them at the end. So, yeah, okay, fair enough. Good. I'll leave this here. Who's up next?